You're watching Baptist Health's Resource Live, where our respected experts bring you timely and practical health and wellness information to improve your family's way of life. We're healthcare that cares. This is Resource Live.
Hi, everyone. I'm Dr. Jonathan Fialco, Chief Population Health Officer for Baptist Health South Florida, coming to you live from the Baptist Health Newsroom. According to a December survey, Americans' top 4 New Year's resolutions for 2021 are, not surprisingly, exercise more, eat healthier, spend more time with family and friends, and lose weight or become leaner, may be a better way to put it. It's no surprise that all 4 of these are meant to improve our health, mentally and physically. Because when it comes down to it, our health is our most precious commodity. So how do we go about making 2021 a healthier year, even in the midst of this pandemic? A visit with your primary care physician is a great place to start. Primary care physicians not only treat illnesses, they provide preventive care, they manage chronic conditions, and they help you navigate this healthcare system that can be quite confusing. They're caregivers, teachers, and many become a family's or a patient's trusted friend. In short, they are essential partners in your health. And today, I'm pleased to welcome 2 primary care physicians to this program. First, Dr. Carol Kaur, primary care physician with Baptist Health Medical Group, who sees patients at the New Health and Wellness Center in Plantation, and Maria Ordonez, MD, also a primary care physician who sees patients at our new healthcare facility in the downtown Doral area. Welcome to the program, guys.
Thank you. Good morning.
Good morning. Before we dive into today's subject, I want to remind our viewers to send in your questions and comments throughout the segment. We're here for you and happy to answer any questions you may have. Guys, let's start with questions regarding the pandemic, which is obviously the most important concern we have in our healthcare delivery right now. Throughout the pandemic, we've been telling people it's important not to neglect their healthcare. Because you're concerned about COVID or COVID exposure, don't ignore signs of your symptoms of disease or preventive services because they're fearful of contracting the virus. Let me ask you both, how has the delivery of primary care changed over the last 2 months? How have you and others adapted to this pandemic concerns regarding, I don't want to get taken care of because I'm afraid of contracting disease, protecting people from getting disease? Let's start with you, Maria.
Yeah, so hi everyone. So during this pandemic, one of the big things is we've made the effort and the change to also being able to see patients via telemedicine. So they have the option of seeing us via video or even via phone. Am I breaking up?
A little bit. You're okay now.
Sorry.
The viewers can lip read.
I'm sorry?
The viewers can lip read. Go ahead. I'm kidding around. Go ahead.
Thank you. No, I was saying about telemedicine. So how we have the option of seeing patients and patients of accessing a provider via telemedicine. That's one of the bigger ones. And so as being able to provide care and many things that we can take care of via telemedicine. And, we were discussing before how once they need to come in, we're still available to see them in the clinic. And there's many things that we are taking precautions in terms of trying to keep the clinic safe, like, screening them, taking their temperature, and for when they do need to come in to be able to see them in person.
And what's your experience been, Maria, when you do these telemedicine visits with patients, the engagement through technology? Do the patients feel it was a worthy visit? Do they feel like they've accomplished a good medical evaluation with the provider?
Yeah, I think they really appreciate it. I think, and for us, it's also new, so we didn't know, kind of what we were going. And I think for both parties, for both involved, I think it's been really good. I think patients really appreciate it because one, of course, the fear of going in, of maybe contracting COVID at this time, even though we're keeping the clinics safe, they don't want to go out riding the car or their bus or however they get to the clinic. So I think the convenience of doing them either in their home or their place of work has been really great for them. And being able to even, we can order labs and then they go do them in the lab. We can send their medications. We can do as best evaluation we can via video. So I think patients really, really are satisfied and pleased that they can access telemedicine.
So Kyle, what are you seeing in primary care practices, certainly in the Baptist area, maybe even nationwide trends? How we've talked before in programs how quickly telehealth and telemedicine has been adapted. What percentage of the doctors or primary care doctors' visits can be appropriately applied in telemed? And then can we talk about what are the kind of visits that maybe wouldn't be appropriate for telemedicine?
Absolutely. So just like Maria was referring to, we are able to see a great majority of conditions and concerns over telemedicine. And I know initially this seemed a little odd to patients and to providers who are new to these types of visits, because essentially we're primary care physicians. Not only do we want to see our patients in person, but having that body language helps us create that rapport with our patient and fosters those long-term relationships. So that is very important. But as we've learned, and as Maria said, we're able to do that still on telemedicine and engage with our patients. And what's even better is sometimes patients are able to see us while they're at home. And that provides for a little bit more of a personal experience. We get into some things that maybe we wouldn't have in the in-person visit. And as you said, there are certain times, so when patients, as much as we want to do telemedicine and not only for their convenience, but to help reduce risk of transmission and contracting the virus, there are times when we need to see them in person, such as if they're having significant respiratory or cardiac complaints, or even gastrointestinal symptoms, or sometimes even if they have a rash and unfortunately the video quality isn't great. So instead of continuing the visit over telemedicine, bringing them into the office for a thorough evaluation is more appropriate.
We say that the art of telemedicine is knowing when not to use telemedicine, but there are significant conditions. You mentioned a few patients can have the visits from home. Do you let family members in the telemed visit sometimes? If
Absolutely. Oh, absolutely. Absolutely. It's at the end of the day, we are here to guide and help our patients. So if our patient is comfortable having their son, grandchild, aunt, caregiver, anybody who they're comfortable with join in on the visit, we encourage that. And absolutely, it also sometimes provides us information that otherwise we would not have been aware of.
That's great. We use masks and gowns where appropriate, and we call them, the personal protection equipment. And arguably the best personal protection equipment is to do a telemedicine visit. And then you don't have to worry about the exposures. Moving on a little bit, and this is something that I certainly see as a cardiologist. Let's talk about the importance of a primary care doctor relationship from a continuity of care. We see a lot of people that, mostly because they're feeling fairly well or may not recognize they have a need, don't have a primary care doctor. They might use an urgent care if they need something, an emergency room, which arguably is expensive and have other problems. Let's talk a little bit about what's that real importance of having a primary care doctor. What do people get in that relationship and in that service that would be missed otherwise by using ad hoc, like urgent cares and whatnot? Kamala, you want to talk about that a little bit?
Absolutely. And I think I can best describe it by referring to that old saying that the best treatment is prevention. A lot of times, most of the conditions and problems that arise in healthcare are preventable, either by simple means as a healthy diet, healthy exercise, routine blood tests, routine screenings. If we do those as indicated, then a lot of times we can prevent those diseases and those ad hoc visits to urgent care or to emergency room, which sometimes not only are unnecessary, but can also be very expensive for the patient as well.
Mm-hmm.
I think, that's a great point. We talk about prevention, and you don't prevent something in someone who's acutely ill. You take a person who looks and feels well and say, is there something going on that could cause a problem in the future that's preventable? And that's when you want to get to those people, people. Maria, a little bit more on that. Can we talk about, the gratification as well as the ability when a patient trusts you and you know about that patient more than just their medical conditions, how you can better make decisions for that person, better, support any kind of medical issues that might come into play? How important is that in a primary care relationship with a patient?
Right, of course, it's also the familiarity with the patients and their story, right? Everybody has a story of where they come from. So I think also, as primary care, we have the benefit of seeing them, many times, or even if it's sometimes once a year, when they're getting their story and kind of I always like to say, working with them as a team, right? Making decisions together. So not only catching their early symptoms if we're trying to prevent disease or detect disease early, but also getting to know them. Also, many of us see family members. So you also get to know their family structure, right? Anxiety or stressors that they have at home. What they do for their jobs or exposures. So getting to know the patient as a whole really plays a big role in their health, and for us to work as a team with them in their overall health.
I think those points are well taken. I see very often, patients will say, oh, I saw a doctor, the best doctor. They did every test in the books. That's not a good thing. Doing inappropriate tests can lead to problems, find things we otherwise shouldn't know about, miss the original things. Is it fair to say when you know a patient and you know their history and you know their concerns by the relationship and they come in with something, you're better able to make an informed decision about what they need versus they pop up somewhere and no one knows them? It's let's just get a whole bunch of stuff because how important is that when you know a patient, when you're making that informed decision in their care?
Right, definitely. Because like, for example, some patients have like recurrent symptoms that we can help them deal with. So if they're seen once, let's say in the urgent care, they're going to run all the tests or in the ER that maybe a primary physician has already done and can sometimes reassure the patient, look, we already did this test, we already did this, I can show you, but if you have any symptom, let's then do another test, or let's try this medication or this lifestyle change. And that way they don't have to get separate different testing or expensive testing. But once you get to know them and you build that relationship, then you can work together.
And even prescribing a medication, knowing the person may have had a side effect with something similar or they have other concerns. So
Right.
I think that, again, the
Or if
important
they
point is
tried it before and gave them a side effect.
exactly right. So having that
Yeah.
relationship with the primary care doctor over time period provides that benefit. I want to get into some preventive services in a little bit, but let's switch gears a little bit and talk about, chronic disease management. We know that a small percent of the population are responsible for a broad part of our healthcare costs. So the people with the medical conditions drive this increased cost in healthcare, which we all suffer from as we pay our premiums. Let's talk a little bit about chronic disease management, things like diabetes, hypertension. Someone doesn't wake up in the morning and say, I feel terrible, I must be diabetic. Let's talk about both how we address those in primary care, but let's also pull into COVID a little bit. There's been a lot of reports that these chronic conditions make a person more likely to have a bad course if they have COVID. Is this something that you're bringing into your conversations with both patients and in your practices and to others in the community? Kamal, can you address how you're handling or how you're referring to these chronic conditions, especially in the COVID environment?
Yes. So as you mentioned, one of the first and foremost things that we like to advise our patients is that no matter what the chronic condition is, especially if you're taking medications for it and you're requiring routine blood work to monitor the stability of the condition, it's important to make sure that it is well controlled so that if you do contract the coronavirus or even the flu virus, your system is it's optimized and ready to fight that infection. Conditions like diabetes, chronic heart disease, chronic renal disease, chronic liver disease, these all do suppress your immune system and make it difficult to fight any kind of infection. So absolutely, it is most important during this time to make sure that your underlying conditions are well controlled and the medications you're taking are appropriate and your blood work shows that as well. So definitely we encourage our patients to please continue connecting with us. And as we mentioned, telemedicine is a great way to do it. It's convenient and we can do it as often as the patient likes and make sure that, we're both going in the right direction.
Are you finding that's receptive? Are you finding in your practice people are saying, hey, it's time for my checkup on my hypertension, diabetes, because it's what they should do? Or are they coming to you saying, because I'm also concerned about COVID? Is it out there in the community at that additional reason to control these conditions?
Yeah, I think people are becoming more cognizant of that latter fact that, yes, we need to control these conditions so that we don't get the coronavirus, or if we get it, we don't have significant symptoms because of it and complications. But there's also still patients that are coming and saying, hey, it's time for my 3-month diabetes checkup and, let's get to it. So it varies between person to person, but the main thing is that we are seeing a good amount of patients still trying to receive care. But like you mentioned, there's a majority of them who are not coming into the offices and not even yet aware that we can do this through telemedicine.
I was actually just going to ask that. I'll ask both of you, and I'll ask Maria first. Are you seeing some patients, telemed or otherwise, who were, I wish you had called a few weeks ago, or, are you seeing the other side? You're seeing the people who are being proactive and saying, I want to see my primary, I don't want to get them. Are you seeing some cases where the patients waited a little bit too long and may have had something relatively negative as a consequence of that? Maria,
We do. I think we're seeing both ends of the spectrums. I've seen patients that want to be really proactive because they're like, I want my health to be, the best it can be so that my immune system is working, so that if I do contract COVID, maybe it's not as severe. But also some patients that are waiting on things because they're afraid to come in. Even several patients like telemed visits that you're like, like severe abdominal pain or some things that you're like, you really need to be seen in person. And if it's this severe, go to the ER. But sometimes their answer is, but what about COVID, right? I'm scared of going in. So sometimes patients are waiting a little bit longer. So that's why I think telemedicine is really helpful, because you have the option of in a visit saying, assessing as best you can with video and saying, look, this is important and you shouldn't wait. Like, don't wait any longer. This is my medical opinion. And these are the reasons why, right? This is what I think you may have. So don't delay and go in.
So it's a great point. I'm going to ask the panel to address the fear of being in the office and what precautions are taking to keep people protected. But the point is, if you're afraid to go in the office, you can start with a telemed visit, and that can determine, hey, listen, we really need to take, lay eyes on you, touch you, versus I think we can handle this without it. So not getting care at all should not be the option that you choose if you're concerned. So Kamal, can you speak to, number one, are you able to, have you seen patients who kind of waited too long, however we define that? And secondly, can you talk a little bit about in the medical practices where a patient does come in, what they can expect in terms of being protected and how we're not seeing transmission of the virus through the medical practices?
Yes. Unfortunately, as Maria was saying, we have seen patients that maybe it's a little too late or they waited too long to address their concern or their symptom. But again, I think people are becoming more cognizant of telemedicine, and as that's happening, that is happening less and less, that patients are coming in too late. But on the other hand, we are still in office, we're still in clinic, and we're still here to see you and care for the community. We've taken every protocol set forth by the CDC and Florida Department of Health. And I mean, I remember in the very beginning, even for a week or so, our offices were actually completely closed so we can prepare to safely allow patients to come back in with minimal fear of contracting the virus. At this point in time, 9 months later, we're pretty much pros at it. We have the protocol set forth. We have hand sanitizers almost every couple of feet. We have social distancing markers on the floor where patients can guide themselves as far as how to stand from each other. We have plexiglass in front of the reception areas. And then once they come back into the clinical areas in the rooms, everybody has the appropriate PPE on. We do ask our patients to wear masks that we provide for them. They can certainly come to the office with their own mask, but we do also provide masks for them to wear while they're in the facility. And all those protocols are being taken, as well as screening questions as well, so that we make sure that patients who, though we still want to care for them, but if they're having symptoms of COVID or if they've been recently exposed, then we can guide them to a more appropriate center for care.
And I commend you and Baptist Health. This message is being taken up by the community. And I can tell you anecdotally, in Miami Cardiac and Vascular Institute Cardiology Group, same thing. At the very beginning, we were finding patients who went into decompensated heart failure, had heart attacks at home, strokes. But now, and especially with the telemed, people are taking advantage of that. I have something going on I'm concerned about. What do I do? And we want people to continue to use those resources available. Don't stay at home afraid of getting your medical care because you're afraid of being exposed to COVID. It won't be through the medical practices. Let's switch back to a little bit of prevention. And specifically, we talk about, let's say, screenings and immunizations. Prevention, I got a person who looks well and feels well in front of me. What would I be thinking? What do I got to do to keep them looking well and feeling well? For many years, the philosophy's been, I'll go see my doctor when I'm sick. And now we actually say, we want you to see your doctor when you're healthy to help keep you healthy, maintain that, not wait for a problem. So let's talk a little bit about prevention and early detection. How do you approach a patient who may come in saying, feel good, just want to be around for a while? Maria, I'll start with you.
Yeah.
What do you talk about?
Thank
what do you
you.
address?
Hi.
Yeah.
I hope I'm not breaking up too much, but
Nope,
yeah, definitely. It also depends on their age, right? We look at their ages and like the different prevention testing and procedures that we do. But the big thing, right? We start with, diet, exercise, lifestyle, how are they doing with stress, right? Their overall picture. We take a good medical history, right? So their family history is important, right? Like what their parents have, or like if there's any cancer, blood pressure, diabetes in the family. So taking a great medical history. If they're feeling well, of course, everybody gets their vitals taken, right? So we look at your blood pressure, your heart rate, your oxygen levels. So just baseline, right? And so that helps us guide us through, right, talking about all the preventive things. So also depending on their age, we're going to do basic blood tests, right? Like look at their, basic exams, right? I always explain to patients like white blood cells, red blood cells, your platelets, right? And then checking for your kidney, your liver, your urine, right? Cholesterol. So we do all the basic exams. And then depending on their age, right? Let's say when you're getting closer to 50, right? You need a colonoscopy. For females, always, right? The pap smear. So all the preventive things that we can do proactively to keep you healthy. And so trying to address all of that in one visit, which thankfully our first visit is always the longest, so we have more time to talk, and always trying to address everything.
Kamal, can you speak to a little bit, elaborate? And again, that's one very helpful, and it really is the part and parcel goal and workflow from that visit with the primary care doctor. You mentioned, Maria mentioned screenings like blood tests, obviously, but colonoscopy, mammograms and things. There's some data that those have fallen by the wayside a little bit, again, in the COVID environment. People are not going to the doctors or getting these screenings. Can you speak a little bit about both the importance of these regular screenings, why we do them, what the data shows, why they're beneficial, as well as how what you've seen in your practice regarding, are people reluctant to get them, or they're comfortable in making sure they stay on top of these screenings?
Absolutely. Unfortunately, we have seen patients put aside the screenings that are so important, such as colonoscopies, mammograms, and the reason being because they don't want to go into the medical facilities and possibly contract these viruses. But as we've come very far along in these last several months, the protocols have been implemented to minimize the risk of contraction. So we are encouraging patients to come back in at least for the annual visit, and we can talk about, can we wait a month or more on your colonoscopy? Is it too soon? Is it too late? And the other thing patients, should understand is medicine is dynamic. Guidelines change, recommendations change almost every few years. So for instance, if a couple of years ago, one particular screening was recommended for a certain age group, that might change. And now it's recommended for a sooner or a younger age group. And patients need to be educated about that. So there's various reasons why we want patients to come in. And then of course, prevention is the best treatment, right? So when we do these screening tests and diagnostics, we can pick up on disease, hopefully in the early stages, and treat it so it doesn't progress and get further.
Proper screenings are based on evaluations from a scientific standpoint of doing this test within this time frame is accurate and safe to prevent something. A lot of times people think, shouldn't I get an annual X, Y, and Z? And they're not recommended for screenings because the data doesn't support that real benefit. Just doing more isn't great. And I bring it up because we're going to have a future Baptist Health Talk podcast on screenings, so that the viewers pay attention to that one. What should be done and what shouldn't be necessarily done. Last comment on this before we move on to another topic, and that's immunizations. We talked about screenings in terms of testing, looking for preventable disease. What about immunizations? How is our community doing? What are the efforts we're doing in primary care to make sure people stay up on their immunizations, as well as what's the importance of that? Kamal, you can address that to start.
Yeah, so part of the annual examination is making sure that no matter your age, your immunizations are up to date depending on your health conditions, your age. And if they're not, then we work together to see how we can get you that immunization. Many of them are available in our offices, and when they're not, we do help guide you to get them. Immunizations are a great way to prevent disease, of course. The point of an immunization is to nudge your immune system a little bit to think it recognizes the disease that we're trying to prevent, and then develop antibodies so future infections can be fought. That is the basic goal of every immunization. And I know sometimes people are apprehensive because certain immunizations contain virus components, so they're afraid of actually getting the disease or side effects. But most, if not all, of these immunizations have been thoroughly studied. The safety profiles we're familiar with, but the effectiveness, it's always harm versus benefit, right? That's all. As doctors, we're always doing stuff that's more beneficial than harmful to our patients. And these immunizations definitely fall into the more benefit than harm category.
Are you getting any pushback when you're doing your primary care visits, wellness visits with a patient, telemed or in person, and you say, listen, I want you got to get your flu vaccine. It's time for you to get, do you get any pushback, or patients have been pretty good about that?
No, unfortunately, we're still getting a lot of pushback on the influenza vaccine, and we do our best to educate our patients and help alleviate the concerns and apprehensions that they have to the vaccine. But it is getting better, I would say. And I think the reason for that is because one of the silver linings of COVID-19, I think, has been more of the public has become familiar with the vaccines in general and why they are so important. So I think that being highlighted is kind of trickling to other vaccines, notably the flu vaccine, because I've had patients who have, never gotten the flu vaccine because of one reason or another, but now because of everything that's going on are saying, you know what, I'm going to go ahead and get my influenza vaccine this year, and when it's available, the COVID vaccine as well.
Right. Maria, I want to expand on something you mentioned in response to a previous question. When you mentioned the kind of discussions that a primary care doctor has with a patient regarding exercise and diet, lifestyle, you mentioned stress, sleep. Let's get into the stress component a little bit, mental health issues. As part of a regular primary care visit, as well as the relationship with primary care doctor, speak to a little bit how important it is to talk to people and get them, for you to be able to identify, for the patient to be able to identify various mental health issues. What are the more common ones that we can help people with through primary care or relationships and visits?
Right, definitely. Well, always in the clinic, as part of every visit, we do screening for depression. It's called the PHQ-2. It's just 2 simple questions that they answer, of how they've been feeling. Of course, if they say yes, then it prompts to a longer questionnaire, mainly screening for depression and how they're feeling. And I think during this time, especially during COVID, we have seen a rise in anxiety, depression, right? A lot of people feeling lonely, that they have to stay at home, right? Stress and worry. And I have seen a lot of patients, like maybe that before they wouldn't have allowed themselves to come forward saying that they've been feeling this way because maybe there's some societal or cultural beliefs that if you ask for help because of a mental condition that, somehow that makes you like weak, or there's different like cultural components to it. So I think a lot of people have allowed themselves during COVID to say, I need some help, this is how I've been feeling, and that allows us to ask more questions. And there's also tools, like for example for anxiety, right, the GAD, where we ask questions, and they're not perfect, but they do help us assess how you're doing, right? And talk about the different options, right? Can we do therapy, right? Behavioral therapy. Can we do some changes right at home with sleep and stressors? Are we going to talk about medication and start it with medication? So are we going to, enlist the help of a psychiatrist or a consultant? So I think there's many things we can do for the patient.
So I think you guys have only scratch the surface in the value of having a primary care doctor and the value of a primary care visit. Smoking cessation, talking about drinking problems, other, family stresses, vitamins, supplements, lots of other things that people may have questions about, or may even do things that might be particularly detrimental. And again, these are things that are also part of that primary care visit. Finally, just to wrap up, before I ask you guys any final comments you may have, there are some questions that have come in. Fortunately, we've answered most of them in our dialogue. The big one, of course, which I think we all get personally daily, is, where can I get the vaccine? Will it be my primary care doctor? I'll ask you both to comment on it quickly regarding how you address that. But the reality is there's not enough vaccines to go away. The state distributes. Every place that gets vaccines handling things a little bit differently. At Baptist, we are doing an incredible job with well over 1,200 vaccines a day to our front care healthcare workers and staff, opening up to the community. Stay tuned. We're not planning right now. Well, I shouldn't say we're not able right now to distribute them to the primary care offices. We'll see where it goes down the road, but everyone who's eligible will be able to find information for that. And if you want a resource, you can go online to baptisthealth.net/coronavirus, one word, /vaccine. That's baptisthealth.net/coronavirus/vaccine. You guys have been great. Any final comments before we wrap up? Anything we missed or anything you want to emphasize or reiterate? Kamal, I'll go to you first.
Absolutely. I would like to echo on everything that we've been saying and encourage our community to reach out to us, whether it's for an annual visit or for an acute concern that you have. We are here to take care of you, whether it's in person or via telemedicine. So I would just want them to know that we're here.
Thank you. And Maria?
Same thing. Encourage them to come and see us. We're here for you, and hopefully to help you with everything that you need. So encourage you to come and have a visit with us.
Well, you guys have been wonderful. You provided tons of information. Your passion for caring for your patients comes through, even through virtual panel discussions. To the viewers, we've covered a lot of ground today. Appreciate your participation. Remember, you can connect with us on our social media channels. That's Facebook, Instagram, Twitter, LinkedIn. Check out our resource blog for the latest news. That's at baptisthealth.net/news, baptisthealth.net/news. You'll find a link there to these episodes, as well as the Baptist Health podcast, a Baptist Health Talk podcast. On behalf of everyone at Baptist Health, we ask you to please stay safe, get your flu shot, do your part to stop the spread of COVID-19. Mask up, South Florida.
Find additional valuable health and wellness information on our resource blog at baptisthealth.net/news. And be sure to interact with us on our social media channels for live and upcoming events. Resource Live is brought to you by Baptist Health South Florida. Healthcare that cares.